lecture is entitled Sex and the Menstrual Cycle by Dr. Bev Knox. Some subtitles could be, Can I have sex while on my period? Or, What are the pros and cons of having sex while on your period? Or, Some tips for having sex while on your period. Let us first begin with defining the menstrual cycle, also known as menstruation, menses, menstrual period, your period, that time of the month, Aunt Flo, Shark Week, Lady Business, On the Rag, and many other slang terminology. The menstrual cycle is a complex biological process experienced by women of reproductive age. It is characterized by cyclical hormonal changes that result in the shedding of the uterine lining or menstruation. The cycle typically lasts between 21 to 35 days and consists of 3 phases: the follicular phase, the ovulatory phase, and the luteal phase. Menstruation is the monthly shedding of the lining of your uterus. Menstrual blood, which is partly blood and partly tissue from the inside of your uterus, flows from your uterus through your cervix and out of your body through your vagina. Menstruation is driven by hormones. Hormones are chemical messengers in your body. Your pituitary gland in your brain and your ovaries, part of your reproductive system, make and release certain hormones at certain times during your menstrual cycle. Let us review a few important questions that you may have regarding the issue of having sex during your menstrual cycle. The first question is it safe to have sex during your period? According to Dr. Chisholm, unless it troubles you, there's no need to avoid sexual activity during your period. Though period sex can be a bit messy, it is safe. It can even have some benefits. Sex during your period is safe, but whether you choose to have it depends on personal comfort. Some people feel uneasy about it, while others find it enhances intimacy and relieves menstrual cramps. If you and your partner are open to it, a little planning can help manage the mess and make the experience more enjoyable. Next, what are the possible side effects or risks? The biggest downside to having sex during your period is the mess. Blood can get on you, your partners, and the sheets, especially if you have a heavy flow. Aside from dirtying the bed, bleeding may make you feel self-conscious. Anxiety over making a mess can take some or all of the fun out of sex. Another worry about having sex during your period is the risk of transmitting a sexually transmitted infection, STI, like HIV. HIV is contained in blood and may be transmitted through contact with menstrual blood containing the virus. Using condoms and other barrier methods every time you have partner sex can reduce your risk of transmitting and contracting HIV and other STIs. If you plan to have sex during your period and you're wearing a tampon, you need to remove it beforehand. A forgotten tampon can get pushed so far up into your vagina during sex that you'll need to visit a doctor to have it removed. So again, according to Dr. Chisholm, while menstrual blood by itself isn't harmful, period sex can increase the risk of sexually transmitted infections, STIs, since viruses like HIV and hepatitis spread through blood. Pregnancy is also possible, especially for those with shorter cycles. Using condoms or other protection helps lower these risks. Here are some tips for having sex while on your period by Dr. Andrea Chisholm. Sex during your period is safe and can even have benefits. However, it can also be messy and the risk of infection is slightly higher. With a little planning, you can make the experience more comfortable and worry-free. Let us review how to minimize the mess. Choose lighter flow days. If the amount of blood is a concern, try having sex on days when your flow is lighter, such as days 3 to 5 of your cycle. Use dark-colored towels. Placing a towel on the bed or furniture can help protect against stains. Keep tissues or wipes nearby. Having wet wipes or a washcloth ready makes cleanup easier. Sex in the shower is also an option for some. The running water can help wash away menstrual flow for a cleaner experience. Now let us review how to make it more comfortable for all partners. Be mindful of your cervix. The cervix sits lower and may be more sensitive during your period, so deep penetration might cause discomfort. Go slowly and adjust as needed. Rethink foreplay. If you're concerned about getting blood on your hands, keep tissues nearby or explore different ways to stimulate each other. To prevent STIs in pregnancy, use condoms. Blood exposure increases the risk of sexually transmitted infections like HIV and hepatitis, so protection is especially important. Consider birth control. If you're not trying to conceive, Birth control methods like the pill, patch, or IUD can help prevent pregnancy. Use dental dams for oral sex. These barriers help reduce the risk of STI transmission. Get tested regularly. Routine STI screenings are key to keeping both partners healthy. Practice good hygiene. Washing before and after sex can help lower the risk of infections. Importantly, letting your partner know you're on your period ahead of time can help set expectations. If you experience discomfort or pain, speak up and adjust as needed. The more open and comfortable you are, the better the experience will be for both of you. So again, according to Dr. Chisholm, sex during your period is safe, but whether you choose to have it depends on personal comfort. Please be advised, this is an educational, academically sound psychology course by Dr. Bev Knox for adult student learners. Lecture content include discussions and representations of human sexuality, theoretical perspectives on sexuality, sex research, sexual anatomy, sex hormones, sexual arousal, attraction and love theories, gender and sexuality, sexual orientation, variations in sexual behavior, sexual coercion, sex for sale, sexual disorders, and sex therapy, ethics and religion on sexuality, and sex laws. Before beginning the course, please be mindful of your capacity to witness and respond to videos, books, and images of this content material.